Good morning and welcome to today's web seminar. We are going to get started in 1 minute. Good morning. If you're just signing on, welcome to today's web seminar. We're going to start in just a minute. We're just waiting for people to get signed on to the webinar. All right, let's get started. Good morning and welcome to our webinar. We are thrilled to have you with us. This is Simone Turek-Lee. I'm with John Burton Advocates for Youth. And thanks for joining us and our partners with the Los Angeles Reproductive Health Equity Project for Foster Youth. We have a web seminar this morning on 2 new training tools for short-term residential therapeutic programs, or STRTPs, as we all know them by. This training curriculum was designed to help ensure staff are equipped with information and resources to support youth in the area of reproductive and sexual health, and to ensure organizations have information and resources to meet legal and regulatory mandates in this area. So some of you may have joined us at the beginning of the month for a webinar where we debuted a guide for STRTPs on this topic. So, that was a publication, a tool to refer to. And then today we're going to talk about training tools based on a curriculum developed by RHEP. So before we dive in, let's move to the next slide and go over kind of just the housekeeping items here. Now, I've already seen someone type into the control panel that they don't have audio. So obviously they can't hear me right now. Hopefully they're looking at the screen and can see how to call in. If you can hear me, but you're having audio trouble that sounds scratchy or too soft, and you're on your computer speakers, we suggest using the phone to call in. You sometimes get better audio that way. So you uncollapse your control panel, that audio section, you use your phone to dial that number, enter that access code, and then you should be connected. And if you have trouble throughout, you can message us in the little chat or the little questions box and let us know you're having trouble, and hopefully we can assist you. We also have handouts, and those can be downloaded from the control panel that says, the section of the control panel that says handouts. You can access the PowerPoint that we'll be going over today. It's right there in PDF format. And there's another handout that we'll be talking about today as well that's there. And as I said, there is a questions box. We are going to do a Q&A at the end. And so please don't hesitate throughout the web seminar to enter any questions you have. We'll get to them during that Q&A. So type them in at any point. We welcome questions and comments. And then lastly, we do record all of our webinars. So we'll be posting this recording on our website at the URL that's on the screen. That's our website, and it's going to be under past trainings. And then we'll also email both the audio and the PowerPoint from today and anything else we promise you through the webinar to everyone who's registered for this web seminar. So you'll get that later today. So let's move on to the next slide. So we're going to start with introducing our panelists in just a moment. Then we'll dive right into an overview of the 2 training tools that we'll be talking about today. We'll provide kind of a sneak peek at the actual training content, and then we'll go over a handful of frequently asked questions, and then we'll have a live Q&A where you can submit, like I said, any questions that you'd like to ask or comments about this. Move to the next slide. So I'm joined today by three lovely people. Again, I'm Simone Turek-Lee, Director of Housing and Health here at John Burton Advocates for Youth. I'm joined by my colleague, Anna Johnson, who is the Senior Project Manager for Housing and Health here at JBay. And as I mentioned, this is an LA-RHEP webinar. We're part of a group called LA-RHEP, and I'll talk a little bit about that in a second. But we're joined today by two of our LA-RHEP partners. So we're joined by Rebecca Gudeman, who's the Senior Director of Health at National Center for Youth Law, and Luciana Spidler, who is the Policy Associate at Children's Law Center of California. So let's move to the next. Thank you, Anna. So like I mentioned, the Los Angeles Reproductive Health Equity Project for Foster Youth, or LA-RHEP, that's a mouthful. So LA-RHEP, as we go by, is who developed this curriculum that we'll be talking about today. And we're part of this group. It's really a collective impact campaign led by National Center for Youth Law and funded by the Conrad and Hilton Foundation. And the goal of this project is to significantly reduce inequitable reproductive health outcomes experienced by youth in LA County foster care and increase access to sexual and reproductive health care and information for LA's foster youth. So while the project is focused on LA, many of the LA-RHEP partners work together on a state policy level to pursue these same goals for all of foster youth in California. And if you go to the next slide, you can just see who all of the partners are on this work. So it's JBay, it's Children's Law Center, Nickel, LA's Department of Children and Family Services, Seattle Children's Hospital, Public Counsel, and the Alliance for Children's Rights. Next slide. So we have a little icebreaker for you this morning. This is a great example of an icebreaker you might do at a training on this topic. So we thought we'd use it here. All of you will either probably be taking training at some point, hopefully, or administering training on reproductive and sexual health for foster youth. And so let's practice this. Let's do this icebreaker. So go ahead and answer the question here, and if you, I'll read it out loud as well. So I feel comfortable engaging with youth and having conversations about sexual and reproductive wellness. So is that something that you strongly agree with, or you agree, neutral, disagree, or strongly disagree? So if you can answer that question, I'll ask it one more time. I feel comfortable engaging with youth and having conversations about sexual and reproductive wellness. So Anna will close us out when she sees that most people have cast their vote, which I hope all of you do in 1 month. And then
great, we're getting to about 75%. So I'll close it out in just a second.
Great. All right, and Anna, do you want to show the results? Great. So, somewhat mixed, but looks like more in the agree section, which is fantastic. I think it's completely understandable if people don't agree with that statement and they're not comfortable engaging about conversations about sexual and reproductive wellness. It's not easy to talk about. It can be uncomfortable, but it can also be fun. It can also be funny. It can be serious. It all depends on how it's received by the young person, the tone they set, the tone that you set with them, obviously, how they feel about it and engage with it. So really part of the trainings that we'll be sharing with you today is really how to have these types of conversations with young people. So let's start talking about really what these trainings are. And if you can move us along. Thanks. So like I mentioned, LA-RHEP has developed 2 new training tools that are based on really the same curriculum, the same content, but there's 2 kind of ways that you can get this training. So one is an online course that can be taken through udemy.com. So it's really an individual course that someone logs in and takes. And then one is an in-person curriculum that anyone can really download and offer at their organization to a group of people in person. So both of those trainings are available at the link there on the screen. And we're going to talk a little bit more about what they are. And if you can take us to the next slide. So we kind of went over an agenda. This is kind of our sub-agenda of what we're going to cover in regard to the training. So we're going to talk about what the content of the training is. So what will people learn if they take this training or they offer this training? How do the trainings work? What learning modalities each training use? Who's the audience for the training? What are ways to utilize each of the trainings given that they are administered in a different manner? How can you know if this training is being used effectively? How can this training inform organizational policy? And then what are the legal or regulatory requirements that this training fulfills? And in case anyone was wondering, because I don't believe I've mentioned it yet, these both are SB 89 compliant trainings. So we'll dive more into that later, but I just want to say up front, because I know many of you on the webinar are maybe wondering that, these trainings will ensure compliance with SB 89, the California Foster Youth Sexual Health Education Act. So let's move forward. So we're starting out here with content. So both curricula cover the same content, as I mentioned. Really, it's the same information delivered with, different length of time, different level of detail, different modalities, right? So first, the trainings cover background and statistics really related to the reproductive and sexual health rights of foster youth. There's a lot of information, very interesting information to learn about, why this continues to be something that I think, we've struggled with, and that why we're working to improve. Then the trainings cover the rights of youth to sexual health care and the obligations of caregivers and STRTPs related to supporting the sexual health of youth. So Anna, if you can just click to the next. So what we're really talking about here is answering questions like these. So, for example, under California law, a minor can get contraception and pregnancy services without parent or guardian permission at what age? Or under California law, can STRTPs require that youth identify their own transportation to receive reproductive and sexual health care? So if you take one of these trainings or you offer one of these trainings to your staff, you would leave or they would leave knowing the answer to both of these questions. So these are the types of questions that people frequently ask and that we cover in the training. Next slide. So the trainings also cover confidentiality and mandated reporting rules, where to find appropriate information and referrals for young people, and how to have supportive conversations with young people about difficult subjects like sexuality and romantic relationships. So Anna, if you can click to the next. So some of the examples here are under California law, can an STRTP staff disclose a youth's pregnancy to their social worker without their consent? Or how do I help a youth identify a reputable healthcare provider? So sometimes these things seem really obvious when we say them, but then when we're in the moment with the young person, it's really difficult. It's really challenging. And we're like, can I do that? What should I do? How do I make a decision that best, benefits this young person? And that doesn't put my organization at, risk of, violating the law. How do I make sure that I'm making the best, most informed decision? And so these trainings really touch on that and really help ensure that we're upholding youth rights, but we're also protecting our organizations and doing what we're supposed to do. So let's move to the next slide. Yes, so training guide materials. So the online training course is straightforward. You go to udemy.com, you take it there. But the in-person training obviously is a little more involved. You're going to deliver it in person. There's a number of supplemental materials you'll need. So this slide kind of shows you everything that's included in the in-person training. A lot of these things are also great supplements to the online course, things you might want your staff to review. So the in-person materials include obviously a PowerPoint and a trainer guide, and the trainer guide has a lot of good information in it, including, how do you prepare as a trainer to deliver this training. And it includes, an overview of the workshop, a quiz that you can administer, a chart that helps, detail out mandated reporting, when to report what, an FAQ, and so on. And you can download the trainer guide online, but some of the other materials you do need to email LA-RHEP for, and then they'll send them to you. And there's no, it's free. It's not intended to be a hurdle, but we just, LA-RHEP would like to know kind of how far and wide the training's being used, and kind of the only way to track that is to just be able to count the number of people that email and ask for it. So that is the reason that we ask people to email to receive the materials. So you will receive them if you send an email, so don't hesitate to reach out about that. Next slide. So as I mentioned earlier, the trainings really just use different approaches to the topic. The information covered are the same topics, but we do it in a different way. So on the left, the online training course, as I mentioned, is available through udemy.com. It's free. It's an hour and a half, so it's a little shorter than the in-person. We know people have a little bit less, kind of attention span when it comes to doing stuff online. And I know we're all learning that very much right now in this pandemic, that with all this online stuff, we've really had to get creative and also learn how to sit with it longer. But so the online training course is shorter than the in-person. It uses lecture, we call mini lecture, case studies, so kind of hypothetical scenarios, and then short quizzes that you have to take the quiz to proceed to the second half. And so that's obviously tries to make it as engaging as we can, given the online format. You can enroll and complete it at any point. One really nice thing about the online option is that you can do it independently, right? So it's not something that, someone's supervisor doesn't have to sit there and deliver the training, or even really do anything while the person's taking the training except send them the link. Obviously, there should be follow-up following that training, and we'll talk about that later. But it's really an independent format, and so it's you don't have to have a lot of organizational capacity to offer this to your staff, or you don't have to arrange for staff coverage where you get a group of people together. It can be completed in sections, kind of as time allows, and it can be retaken. So then the in-person training curriculum on the right here it's 2.5 hours, so it's a little longer, but it's not, it's not an all-day training. It's still short. It covers 7 different modules, and it uses lecture, also case studies, quizzes, and then there's activities. So there's role play and discussion that's included in that version. So it's a little, obviously more interactive than the online version. There's a pre and a post test, and there's an extensive appendix. So I think we are now moving on. I'm going to pass it over to Anna to talk about the audiences of these 2 trainings.
Well, good morning, everyone, and thank you, Simone, for leading us in today. My name again is Anna Johnson, and I do work with a learning community as part of the Los Angeles Reproductive Health Equity Project and at JBay, where I work with STRTP staff members from organizations across the state, and training on this topic was one of the first things that folks wanted. And so I'm so happy to be talking to you today about this. So special good morning to those of you who are joining us as part of our learning community. I see that you're here, so it's good to be with you again this month. And then for all of our other audience members, the training that Simone just introduced is appropriate and designed for any STRTP staff or administrator, and I'll talk to you briefly about the intended audience and uses for this training. So first of all, frontline staff are working directly with young people. They get the questions about reproductive sexual health rights, about dating, relationships, the body hygiene, development, all of these good things that are happening to young people that are natural as part of their development. And frontline staff who take these trainings can really help serve young people, uphold their reproductive and sexual health rights, have a better understanding of their obligations and duties as not just staff, but as that young person's caregiver, knowing that, this is a time in their life where staff are acting as parents and conversations a parent would have, facilitating access to age-appropriate, medically accurate information and services. So these trainings are to help, so as you saw the results of the poll earlier, some folks are feeling very comfortable sharing this, talking about this information. Others are kind of agreeing, and then some are uncomfortable. So this is really designed for frontline staff to help them feel more secure in their knowledge base and in their interactions with youth. So for management and leadership of STRTPs, they're really working on supporting their staff, making sure staff are in compliance with those legal mandates and duties of the caregiver under the law. They're updating their policies and procedures manual, and that's something that we do help with as part of our learning community. But the laws change, and it does require some shifts in practices over time. We'll talk about those laws in a minute. For administrators, including human resources, these trainings have been used sort of as polling scenarios or questions for the hiring or interviewing process, or to screen candidates who may be uncomfortable upholding certain reproductive and sexual health rights of youth. We want to make sure that staff who are hired and working in STRTPs are prepared for sort of those duties and responsibilities and are comfortable with them. And finally, we know that volunteers come into contact with youth, especially this online training that can be taken at any time that Simone mentioned, will help build that awareness of youth rights, the knowledge of age-appropriate support, without imposing personal beliefs that can sometimes leave STRTPs at risk for sort of grievances or complaints. So we've designed these trainings and providing them to support STRTPs in the various roles. So these trainings can also be used for multiple needs as far as how organizations are run and conducted, and training and supporting staff. So the online training course. Oh yes.
Sorry to interrupt you. I don't think the slides are advancing for people. I would say if they're not going to advance, maybe try giving me mouse control.
So are you not seeing where it says the trainings can be used to fulfill multiple needs with online and in-person?
I am seeing that. Is anyone, please chat us if you are not seeing that now. No, it looks like everyone's fine now. Okay, thanks.
Okay, sorry about that. So yeah, let us know. We'll pause if I know there's been some issues with GoToWebinar, so just keep chatting us. I'm tracking the chat here. I've got a couple of questions that I'll answer in a minute. So just keep putting those questions in. Thank you. So when we talk to our learning community members from our STRTPs, they're using these different trainings and information throughout their kind of organizational practice. The online training course we really recommend as a great tool, like we mentioned, for hiring and screening of new job applicants and staff. For onboarding new staff who could be entering any time of the year, you may have an annual training, but if that happened last week and you have a new hire this week, they wouldn't get that for another year. But with this online training, you can really onboard people as they're joining the organization and have that kind of baseline of understanding of the rights and the duties met. If there's ever a corrective action plan, there are some folks on from the licensing division, and often when those things happen or a supervisor wants staff to better understand the law or to implement the practices, the best practices, these trainings can be used as a refresher or if confusion has arisen. That can often happen as laws change over time. So this is really here to support you, and that online training, again, is flexible, as Simone mentioned. So the in-person training, that's something where we're hoping folks will build that into their annual training practice, discuss those, and then, in supervision or other smaller team settings can discuss individual content areas or special populations that you're serving could be added to this training and kind of augmented. STRTPs have staff trainers or trainers that they contract with who could develop expertise and then offer this to any community partners of a fee-based training as well. So everything that we're offering here is free. We do have a question if it's available in Spanish. Right now, these are not yet translated in Spanish, but I'll have Rebecca maybe talk about any future plans for that. And then the online course, it does offer a certificate of completion, and I'll share that in just the next slide here. I just wanted to kind of launch this audience poll because I know the laws that we'll talk about briefly were implemented since 2017, and folks are working on implementing. So we're just trying to see what ways do you think your organization would utilize these trainings based on what we've just discussed. And I'll launch this poll in just a moment, and you can answer that question. And I'm launching it now. And you can select as many of these as you think your organization would be interested in doing. Great, so I'm seeing people are answering the question. Great, and about half of everyone's voted, so I'll just wait a little bit longer to close out the poll, let everybody get a chance to kind of think about this. How would you really want to use these trainings and build it into your organizational practice? All right, so I'm now going to close out the poll. Most people have voted. And I'm going to share these results so everybody can see. So yeah, it looks like, there's a range of uses. Of course, annual training is one of the, the best uses, especially for the in-person kind of classroom training. Obviously, with COVID right now, that would be modified a little bit. The scenario for interviews and hiring is like 30%, onboarding training, refreshers, that's wonderful. And it looks like there's a good mix of uses for the online training and then the classroom training. So thanks for taking a moment to fill out that poll. And let's see, I just want to make sure people can see the screen again. I think you can. So just a little bit more about, why these trainings, they are SB 89 compliant, and they're so far, we're using these for effectiveness. So the online training course, it does have quizzes. So you take the section, there's a quiz, you have to take that and pass to advance to the next section. And this is one of the questions that we did receive from the audience here about, does it provide a certificate? And yes, it does. So that certificate is given when you complete the training. So there is a little bit where there's a contact. So you complete the training, it shows up, and then you contact RHEP and they'll send you your certificate of completion. Again, that's self-administered training. You sign up for it, you take it at your own time, and then you can show proof that you've completed that course. So for the in-person training, it does provide instructions and materials. We have a pre and post test that you can use with your staff. You can see improvement on those areas, or if you end the training, then your trainers can go ahead and add more content in those areas where staff were maybe not as comfortable. And then there's also, you can have trainees complete an evaluation at the end of the in-person training curriculum. And that can help you understand as an organization, where do you want to build out and maybe talk about more topics in depth or take more time with certain activities to support your staff. So these curriculums, they were piloted with STRTPs. So here's some feedback that we received from staff who took these trainings. So saying they've gained greater understanding of sexual and reproductive rights of youth. They're able to give clearer answers when young people ask them questions, and instead of just saying, you know, I'm not going to answer that, or I don't know how to answer that, but really knowing how to direct youth to the reliable resources that are approved for young people. Feeling more comfortable to make themselves more available to communicate with young people about their sexual and reproductive health, and making a plan for when and how to discuss healthy behavior, what is and what is not healthy with young people. So one more thing that I just want to share with you before handing it over to cover the laws is that we do have a resource for, if you are an STRTP kind of management, leadership, administrator, and you're working to update your policies and procedures, we do have a Key to Compliance guide that has an appendix, a checklist for the various areas, including training staff and how to kind of update that procedures manuals in compliance with law and regulation. So this resource is here for you. It's just a kind of easy way to kind of come into compliance with the laws. And you know, if you have any questions about this material, you can reach out to myself or Simone, and we will be happy to assist you with that practice. Great. So now I'm going to hand it over to Rebecca.
Thank you, Anna. Good morning, everyone. Just as a quick reminder, this is Rebecca Gudeman with the National Center for Youth Law. Anna highlighted several reasons one might choose to provide this training, including informing policies, but as she also noted, it can help STRTPs ensure they're in compliance with meeting new legal mandates. State law and STRTP licensing standards have changed dramatically in the last 5 years, and these changes do directly impact day-to-day practice in the STRTP placement. And since we've referenced these legal changes several times, we thought it might be helpful to just take a few minutes to highlight a few of the changes that we've seen in the last 5 years at the statutory, regulatory, and county levels. Anna, if you could go to the next slide, please. So one of the first big changes at the state level was in 2016 when the California Department of Social Services issued what was called the California Plan for the Prevention of Unintended Pregnancy for Youth and Non-Minor Dependents. And you can find that up on the CDSS website. This document laid out what caregivers, including residential placements, are required and allowed to do vis-a-vis reproductive health care and provision of reproductive health information for young people, as well as summarizing youth rights to sexual and reproductive health care. It was truly the first time this information was gathered in one place. The next big change was passage of Senate Bill 89 in 2017. This was also known as the California Foster Youth Sexual Health Education Act. And you've heard reference to SB 89 several times today. This is the law that we're talking about. SB 89 made a number of changes to different state statutes designed to do the following three things. Ensure that young people in foster care receive comprehensive sexual health education at least once in middle school and once in high school. Ensure that youth are informed of their sexual and reproductive wellness rights, and critically require mandate training for certain professionals, including caseworkers, judges, and caregivers on sexual and reproductive wellness. As part of this mandate, STRTP administrators are required to receive this training. SB 89 didn't require a specific curriculum, but what the law does do is say that these trainings need to include specific content, and it lays out the categories of content. So when we've referred back to the SB 89 compliant training, it means that the trainings cover all of the required content from this law and would meet any required training for STRTP administrators or others required under this law to take the training. So SB 89 passed and went into effect in July 2017. But in addition, between then and now, California Department of Social Services has issued a number of all-county letters and all-county information notices clarifying the existing rights of youth and clarifying some of the obligations of STRTPs related to supporting sexual wellness for youth in foster care. Next slide, please. Many of these new and existing obligations described in the California plan and in the new law have been incorporated into new interim licensing standards for STRTPs. The first interim licensing standards incorporating these requirements were issued in 2019, and we have a brand spanking new version of the licensing standards that were issued just this last month in September 2020. These new licensing standards make much more explicit what STRTPs may and must do in relationship to supporting the sexual and reproductive wellness of young people. So for example, the new licensing standards make clear that STRTPs have obligations around providing transportation to sexual health care appointments, and that the young people have a right to choose the healthcare provider of their own choice for that sexual health appointment. And in some cases, the new licensing standards change what was longstanding prior policy. So for example, the licensing standards now make clear that young people can keep sexual health medications, including birth control pills or, for example, STI treatment medication, in the youth's private storage space. This actually goes against the prior requirement that required central storage of all medication. So it's really important that everybody understands where rules may have changed and how this impacts your policies and practice, and that staff have been updated and trained on these new rules and how to support young people. Next slide, please. Because these rules are so new and sometimes feel and in fact may be contradictory to what prior practice or was, California Department of Social Services has issued a number of different guidances. One example is called the Healthy Sexual Development and Pregnancy Prevention for Youth in Foster Care for Children's Residential Facilities and Resource Families. This is specifically for STRTPs and other residential placements. The guidance includes case scenarios, frequently asked questions, and hits on all of the topics you see highlighted on this slide. Many of the cases in the STRTP trainings that have been described today come from this CDSS guidance. So we've really made an effort to try to connect the training back to the guidance that has come out of the Department of Social Services. The training also includes links to this guidance and other materials that CDSS has developed and made available on their own Healthy Sexual Development website. Next slide, please. So that was just a taste of some of the changes that have happened at the state level, both in state law and in state regulation. But it's also really important to make sure that folks take a look at county policies. For example, some counties have implemented their own policies and their own requirements related to sexual and reproductive wellness and obligations of STRTPs to meet certain standards of care. Los Angeles County is one example of a county that has implemented its own policies. Los Angeles County now requires that contracted STRTPs ensure that their staff receive 8 hours of training on reproductive and sexual health annually. Here's some links to some of the LA County policies. This is just one example. If you are an STRTP providing services in one or in multiple counties, it really behooves you to take a look at what those specific county policies are and make sure that that you are aware and in compliance with any of the requirements that they may be placing on you through their contracts with you. Next slide.
All right. So I'm going to launch this poll.
Yeah. So
I'm going to mute and let you take it over.
Thanks. Have you ever received training on sexual and reproductive health? And this could be either one of an SB 89 compliant training or another training as part of your as in sort of whatever professional role you are currently playing related to child welfare. Have you ever received training on sexual and reproductive health?
Looks like the majority of people have voted, so I'm going to go ahead and close it in just a couple seconds here. 5, 4, 3, 2, 1. I'm going to close it now. All right.
Great. Well, it looks like a slight majority of you have, and that may be part of why we saw a majority of folks agreeing that they felt comfortable having conversations with young people. So that's great. Thank you for all of you who've done that. And for those who haven't, I'm glad that we're able to introduce some new training opportunities for you. Okay, I think that for the next section, I'm going to pass it over to Luciana Svidler from the Children's Law Center to give you a training sneak preview.
Hi, everyone. This is Luciana Svidler, as Rebecca mentioned, from Children's Law Center of California. And yes, my part is to give you a little sneak preview as to what you can find in these trainings. You heard what we're going to cover, the importance of it, but just to give you a little inside look. Next slide. So throughout both of our trainings, both the online one and the in-person one, we have embedded throughout them case studies that are based on real stories that we have seen and experienced with our clients to bring things to life. It's one thing to learn about the rules, responsibilities, and all the things we cover in the training. It's another thing to really see how it plays out in real life and how staff working with the youth would deal with the situation. So it helps everyone kind of understand how these things play out and to work together to kind of discuss and see how they would be treated. So one of these case studies, I'll just read it to you so you can see the kind of case study we have in our trainings, is Emily. And Emily receives a brown paper bag with a packet of birth control pills in them at the doctor's office. When she gets back to the STRTP, Emily brings the pills to her room. Can she keep the pills in her room? So this is obviously based on a right of Emily. And as it was mentioned earlier in this webinar, we do go over all of the rights of youth and care. Next. Next slide. In addition to the case studies, we also have activities. And these are also to practice everything you learned throughout the training, and also to encourage an exchange of ideas and discussion among the different people participating in the training. If you do it in person, there are some activities. Obviously, they're more limited in the online version since it's just one person taking the training. But the topic doesn't come easy to everyone. I know some people have had previous training, some haven't. Some people feel comfortable talking about these issues with youth, some don't. So having these activities is really a way to create a safe space for everyone to discuss everything and work through together how they would deal with certain issues. So one of the activities is about how you communicate with youth in your care about these issues. And as RHEP, the organizers of all these trainings, we have a youth advisory board, and we have done a lot of just checking in with them to see, to get the youth input as we develop these trainings. So one of the slides that we have here, which is available in both trainings, is from a youth perspective, how they would like to be communicated with. So this is their advice. Be inclusive and not gendered in how you ask questions. So for example, you wouldn't want to ask, do you have a boyfriend, do you have a girlfriend, but you want to ask, are you in a relationship? Look calm and give us full attention. Watch physical cues for signs of anxiety or stress. Don't assume we're all sexually active and don't assume we're not. Some of us may have already experienced something non-consensual. Don't set a lower bar for us just because we're in foster care, and make sure that there are no language barriers. So, you know, whether it's lingo or the way you reference certain things, just understand that you're in the same level when you're discussing things with the youth. So again, using this advice from the youth, then we would launch into an activity of practicing communicating with youth about certain topics. And finally, in addition to the case studies and the activities, we also have a few quizzes throughout the training. And these are really just to test your knowledge. Once we go over certain topic areas, you could see what you learn, what has stuck with you, and what you might want to go back and review. Next slide. And are you able to switch the slide? Perfect.
So yes. Oh, okay, there you go.
Yes. So, you know, this is an example of a quiz we have embedded in our trainings. I'll just read you a couple questions. Number one, young people in foster care must obtain permission from their parent or guardian before they can obtain emergency contraception. And these are true or false questions. And again, whether you know the answer right now or not, it's not important. This is something that you definitely, the knowledge you will get once you complete the training. So number two, if a youth requests help getting to a sexual health appointment, the STRTP may explain to the youth that they will need to find their own way to the appointment. Three, a young person living in a group home facility must give her birth control pills to staff for safekeeping and placement in central storage. And four, a 12-year-old may obtain contraception, including condoms, on their own and without involving a parent or other adult. So these are the kind of questions that you will know the answers to once you've completed the training. Next slide. So now I'm going to go over some frequently asked questions and answers. These are questions that we have received in the past when introducing the trainings and providing the trainings. Hopefully this will help answer some of the questions you may have. We will also have time at the end for questions and answers if you have any questions that we have not covered in this training. So don't worry about it, hold on to those questions. Let's go over some of these frequently asked questions. So the first question is, who is qualified to deliver the in-person training and how should they prepare? So ideally, a person with training experience on the topic of reproductive sexual health would be great. But the training guide does provide information and materials that if a person reviews them and prepares, it will allow them to provide the training themselves. So they could look at all these materials ahead of time and prepare to train on the topic. Question two is there evidence that these trainings are effective? We have conducted pre and post tests, and these tests have shown both that staff confidence speaking with youth increases after the training, so they're more comfortable discussing the issues, bringing up the topic, having conversations. The pre and post tests have also shown an increase in the correct answers about youth rights, the law, and sexual health risks. Again, we do have quizzes throughout, so all of the results have shown an increase in knowledge. How do you suggest LA County contracted STRTPs meet the 8-hour training requirements? This is a question we have because, as it was mentioned earlier, LA County is one of those counties that is requiring 8-hour training. So the online training is recommended for new hire onboarding, and then there's an in-person annual staff training. But really, any way you'd like to mix and match is a great way to kind of build on each other to reach the full 8 hours that are required. Another recommendation is that you contact Planned Parenthood trainers or other organizations that could provide additional staff training on very specific topics that deal with special populations such as LGBTQI youth, CSEC, parenting youth, etc. So there's definitely ways to get a little more specific information on these topics. And if you notice on the slide, JBAE does have on their website a link to Planned Parenthood around your area. So you can contact them. They all do provide some form of training. We're a faith-based organization. Is there an exception, or are we still expected to comply with sexual health mandates contrary to our personal beliefs? So I just want to make clear that there's no exceptions for faith-based organizations. All organizations that receive foster care funding from the state and provide placement are required to comply with these requirements. The content of the training cannot be modified based on any organization's beliefs, values. And this is true, just to clarify for everyone, under state guidance and regulation, whether it's a social worker, a caregiver, or even an attorney, you know, everyone has to provide the information and not let religious beliefs or their own personal bias get in the way. I'm a foster parent. Can I take this training? It was mentioned already, but I'll mention again. There is training available that has very similar content, but it's specifically targeted or it's tailored for resource families. So the way some of the issues are addressed or some of the rights, responsibilities, those kind of things are really tailored to resource families. So if possible, you should be taking those trainings. If we look at the next slide, there are numerous trainings available. The one we have been focused on today has been for STRTP staff, but there is training available for caseworkers, such social workers and probation officers, resource families, STRTP staff, and judges. All of the links are available through the JBAE website. For example, for social worker probation officers, there's a CalSWAC e-learning training that has different modules, kind of like the STRTP online training. They also have a classroom training, and you can download a one-day training guide and materials to provide this training. There's the JBAE Resource Family pre-approval training that was mentioned earlier, and we have these RHEP STRTP trainings. I did see in the chat box that there was a question about FFA training. If you are talking about a resource family through an FFA, I would advise that the resource family take the resource family training. If the question was referring to FFA workers, social workers, we have gotten questions about that. We have had FFAs reach out to us, and we're currently looking at, and hopefully we can get it done sooner, put an FFA, something similar to the STRTP one online, but for FFA workers, it would have a lot of very similar materials, but again, we would tailor it for FFA social workers. I think that covers all of our FAQs, and I'm going to hand it over to Anna at this point.
All right, thank you, Luciana. And we'll just launch this poll here. Our final poll is, does your organization currently conduct a reproductive and sexual health training for its staff? So I'm going to launch that poll. And again, you know, now that you've seen the overview of the law, we have these available trainings. Whether or not you're currently doing this, you now can. So that's the good news, is that we've been working across the state to kind of take care of developing trainings for the various different roles, you know, as Luciana just mentioned. And that kind of links to all those available trainings are in the handout. So go ahead and download that PDF. And just about half of you have taken the poll, so I'll close it out in just a few seconds. Let me see. I'm hearing that I'm kind of cutting out, and let me see. Is this easier to hear me? Simone, could you let me know?
There's just a little periodic kind of, we lose a little bit of your voice. Keep talking. Let's see if it's fixed itself.
Okay. So I'm going to close out the poll. And let's see, how did we do? Yeah, so we are, you know, just sort of showing that there is, some organizations have started to do this, but now more can. We do have this tailored curriculum. So I'm going to talk now about the supports that your organization can receive from LA-RHEP or from JBay here to do this. So let's see, next slide, please, Simone. So the first resource that we've developed is this guide that, again, it reviews the existing laws and licensing standards that apply to STRTPs around reproductive and sexual health policies and practices. There are 5 key focus areas of the law around training requirements, maintaining confidentiality, access to services and resources, information and talking with youth, removing barriers to care, and protecting youth from bias and discrimination, and making sure that they receive appropriate care if they are LGBTQI, if they are, you know, a young parent. You know, how do we do this? How do we go about doing that? So we had a webinar last month on this topic. You can watch that webinar, or you can download this guide and use the appendix. Has a lot of resources and also that checklist we shared earlier. So next slide, please, Simone. If you are an STRTP staff member or administrator, trainer, and would like to join our learning community, you can find out more about that. We do meet on a monthly basis. This month's activity was this webinar releasing these 2 new trainings for STRTPs. Next month, we'll talk about implementing some of this, and we do offer one-on-one technical assistance calls just between us and your organization to help update any policies or protocols, link you to trainers or resources that you need, answer any technical or legal questions around the law and clarifications of the law. So please contact me if you're interested in joining our learning community. And next slide, please. Another way to stay informed with LA-RHEP's different activities and resources as they become available is to sign up for LA-RHEP's email list. That they provide new resources and trainings as they're coming out, new information around reproductive and sexual health rights. So this link right here, fosterreprohealth.org, is how you would do that. Next slide. And now we're going to spend about 10 to 15 minutes answering a number of the questions that have come in through the control panel here. So please take a moment to answer or ask any questions, and we will start to cover those now. Again, some of the common questions that I'll start with are that the presentation materials will be posted. You'll also receive an email with the recording link and the materials, but they're also, the materials are here in the handout section on your control panel. So you can download those now. The new trainings that we referenced today, both the online link and then the in-person training curriculum link, those are right here using this link on the screen. And for a copy of that full training, so if you're the trainer who's going to be giving, you need the slide deck, you need the quiz, you need all of those materials, you contact fosterreprohealth.org right here, and you will get that full set of curriculum materials and things that you'll need to deliver that training. So now let's start with some of our Q&A questions. So I think, Simone, I know that there are a number of SB 89 compliant trainings. These are designed for STRTPs. We had a question earlier about, is this available in Spanish? There are some trainings that are available in that handout that are available in both English and Spanish. So Simone, could you talk about those a little bit?
Sure. I think we may have covered this when you had your computer mishap, but yeah, let's just, let's just actually repeat it one more time though, because I know people sometimes are in and out of the webinar. So there is a resource family training option that is available in Spanish. The PowerPoint is in Spanish. And like Anna said, all of that is available on that link where you saw that the training matrix. So that's an option, and that's where you can also get trainings for the other audiences that Luciana was mentioning a few slides back.
Great, thank you, Simone. Another question that we have, and maybe Luciana, you could touch on a couple of these, is that there's a few questions around that 8-hour training requirement for LA, which was in the Q&A section that you covered. One of the questions is, can we repeat the same training throughout the year to get to 8 hours, or what should we do to reach that 8-hour requirement, and can you discuss that requirement? So I don't know if there's anything you want to add, Luciana, beyond what you shared or that advice. I think the best advice that I would sort of say here is to really use that, the trainers that are available to expand on the topics or go into further depth.
Yeah, I mean, I would, the requirement is an LA County requirement with STRTPs. It's in the contract. And again, I'm not, I don't have access to the contract, so I'm a lawyer, of course, and I would say you should get your contract to see what the requirement is. But I think it would be, a good use of the 8 hours to build on what you've already learned and kind of focus on specific populations. I know STRTPs focus on different populations, so it might be that you work in an STRTP that really deals with a certain population of youth, and you want to go more in depth with that population as to how to provide support and care to them. So I would use the 8 hours to really make sure you build on your knowledge in-house. That's not to say, you might find that a refresher course for your staff is helpful. That, that always helps too. I know there's turnover, and we have found in our own LA Rep research when looking at trainings that if you kind of do follow up a few months later, the information stays with you longer. So that you might find that that's more helpful to your staff to do some reinforcement of what they've already learned. So it's really specific to what the needs are.
Thanks, Luciana. There's another question from Reginald here about San Bernardino County. So they're asking, you just mentioned, look at your county contract to see what's required as far as numbers of hours of required trainings, and where could we find that information?
I would contact, so every county's child welfare agency contracts with the STRTPs, and that's all the requirements that the STRTP has to comply with the county would be in their contract. So I would, if you have a point person, like I know if you have a point person in your county that works strictly, it's kind of the go between the county and the STRTP, or there's maybe like a technical assistance person within the county that works with your STRTP, I would check in with them to see what their local requirement is.
Great, thank you. So another question is, maybe I'll have Rebecca answer this, is what is a sexual health appointment? Is that part of the annual physical? Is it different? So Rebecca, can you just talk about briefly, and I know the trainings go into this in more depth, so when you take the trainings, you will learn the answers to these questions, but Rebecca, can you just kind of touch on that?
Sure, it's actually a great question. Yes, in an annual exam, when Medi-Cal does say that part of an annual exam should include a provider touching on sexual and reproductive health needs, but when we say sexual health in this context, we are referring to services that minors are allowed to access on their own and under their own consent under our state law. And that means any services related to pregnancy or the prevention of pregnancy, or services related to the prevention, diagnosis, or treatment of sexually transmitted infection. So that might be someone who is interested in having a counseling session with a healthcare provider to understand puberty and contraception and sexual health, sessions to understand consent and negotiation of sexual relationships, as well as any of the range of services that might relate to pregnancy prevention, diagnosis, treatment, or sexual transmitted infections. And I should add that because of confidentiality rules, a minor isn't required to share exactly what they are looking for in a service. If they say that they're interested in a sexual or reproductive health appointment, or an appointment with, Planned Parenthood or another clinic that is obviously about family planning, the obligation is to create that connection, and there is no obligation to dig in further, and in fact you're not supposed to dig in further to find out sort of exactly what they're looking for.
Great, thank you, Rebecca. I know the maintaining confidentiality part of the online and classroom training does get into those kind of rules and who can see what, how do you know what's sensitive and confidential, and how to, some of those questions are posed in the training. So thank you for asking that question and for covering it, Rebecca. Another question is, if we have CSEC, which is commercially sexually exploited children, and LGBTQI trainings already at our organization, does that add to the required 8 hours? So Rebecca, I don't know if you can talk to that a little bit.
I think, as Luciana said, part of meeting those 8 hours could be a combination of an SB 89 compliant training and then the additional add-ons of a training related to supporting commercially sexually exploited children and LGBTQ rights and services and supports. But being a lawyer like Luciana, I would say the key is to look at your contract with your county and make sure that the specific trainings that you're providing would be considered something that would help them meet that 8-hour requirement. But it certainly sounds like there is great potential that in combination with an SB 89 compliant training would help you meet that 8 hours.
Mm-hmm. Yeah, and making sure that the content again is legally compliant and kind of in line with those topics from the CDSS guide that explains for residential facilities those topics and what that covers, and then looking at your county contract. Again, as we mentioned, we do have those rosters of experienced trainers who are going to be using medically accurate, sort of legally compliant trainings, and those are kind of safe folks to contract with to make sure that you're more in line with this. So who can train? I don't know, Rebecca or Luciana, who would want to answer that. I think, Luciana, you already kind of touched on this with the classroom training itself. It provides a description of the materials, the background information and resources that, you know, a trainer that's using this curriculum would want to read and review. There's a FAQ that the trainer can use to answer questions as they come up and to have the correct kind of legal and medically accurate answer. So I don't know if you want to add anything to that about who can train or who you suggest would be the trainer for organizations.
I mean, I think, you know, the information's all there in the Train the Trainer guide, so you can have kind of the background you need to train. Having done the training myself, I think someone from the who is open and comfortable with talking about these topics would be great. You know, because it's great to lead the conversation and to get folks involved. So you have to be comfortable with the subject matter. And, you know, just like every other kind of training, someone who is, again, comfortable with the subject matter. If you're doing an in-house person, it would be great someone that the staff is comfortable with, because it is the kind of subject and training that requires some communication and interaction, and just kind of building a safe environment to discuss these topics. So that would be great too. But as far as the information necessary to train, it's all available in the Train the Trainer guide. And again, I believe, Anna, you touched upon it. If questions arise out of the training that may not be covered, there's a lot of links to sources of information where you can look up the answers to these questions. And again, you know, RHEP, John Burton Advocates for Youth, there's a lot of us available to post-training answer any very specific questions.
Thank you. So there's a couple of kind of legal questions here where, again, when you take these trainings, these questions will be answered as part of those trainings. But Rebecca, we have two legal questions that I sort of sent to you. One being, what is the youngest age that a youth can see a doctor without parent or agency consent?
Yeah, so it depends on the services that the minor might be seeking. But one, and you will get the grid that sort of explains what age a young person needs to be able to access services on their own. But when it comes to pregnancy-related care, whether that's pregnancy prevention, pregnancy testing, or pregnancy prenatal care, pregnancy options, there is no age limit. Minors of any age in California can access those services on their own consent. Now, I know sometimes you say that and people immediately think of extremely young kids and it sounds really scary, but the idea behind this law is that if we have a very young person who has questions about pregnancy or thinks that they might be pregnant, we want to leave every single door as wide open as possible for them to see a trained professional who can address whatever their immediate health needs are, but also ask them about the context for their questions. It may be that which is not, this is actually quite common. Somebody never received good sex ed and they think that, you know, sitting, holding hands with someone or kissing them can lead to pregnancy, and they have some questions, and it helps create a space to address their education needs. If it's someone who may have been sexually assaulted, it creates a space where a mandated reporter can identify needs and make the appropriate referrals. So that's why there's no lower age limit, but that means for practical purposes, no matter how young someone is, if they're asking to see a doctor around pregnancy-related questions, they have the right to do that on their own without needing parent or agency consent. And then again, a health provider, if it's someone extremely young, likely will be making a mandated report, and the agency will get engaged at some way. For sexually transmitted infections and prevention, the age is 12 or older. For mental health related services, it's 12 or older, and you can look at the materials in the training for information on other minor consent laws.
Thank you, Rebecca. Another kind of rule question were, do rules for contraception obtained at health clinic apply for co-ed facilities, or are there different rules and statutes in play?
What our state law and licensing standards now say is that they make it clear that young people, male, female, whatever gender identity, have a right to obtain, possess, and use contraception, and that means keeping it in their private storage, locked storage, and there's no differences in co-ed facilities, and that might include condoms, it might include, birth control pills, other kinds of contraception, but there's no differences between single sex or co-ed facilities, and it doesn't matter where they obtained this, whether it was someone who went to a pharmacy or someone who went to a health clinic or an annual health checkup.
Great, thank you. And just to add to that, the key to compliance guide for STRTPs, it does have a section on the storage policies and recommended and referencing the interim licensing standards and what they say. So for kind of a quick look at contraception and the ability for use and their right to have that in their personal belongings, you can reference that document, and the trainings include that as well. So have another question, and Luciana, have parents of youth in care been advised of this new law? Do they have any rights to forbid the STRTP to allow a child to go to sexual health appointments, and how should caregivers respond?
There has been no advisement of parents. I mean, parents have attorneys. Whether they have told them the information, it's really up to their own attorneys, but I don't know that there's been any advisement. There's not, let's not get confused. There's new laws about, staff and social workers informing the youth or documenting that they inform the youth. But these laws that are covered in the trainings that, of course, we haven't gone over them specifically to allow you to take the training, but like that, for example, that youth are able to go to these appointments on their own, those are laws that apply to all youth in California, and they're not new laws. So whether they're living with their parents or they're living in an STRTP, youth in California have certain rights. And no, they're not able to just override those laws. Did I miss a part of the question? I just want to make sure I answered it fully.
No, I think that's right. And for that question, again, both the key to compliance guide goes over those rights, the reference to the law and the licensing standards, and also the training. So when you take the training, that'll be covered. So another question, maybe. Go ahead.
I just want to, as Luciana said, these are the same rights that every young person in California has. But I think what's really important for folks to know is that the vast majority of young people do involve their parents in sexual health questions and advice and in medical appointments. The key, though, is it's the young person's decision when to involve a parent and how to involve a parent, and that's true whether they're in foster care or not. And in fact, for many young people in foster care, the person they trust to go to with these questions is their biological parent, but they may not feel as comfortable or safe talking to, let's say, a social worker about it. So the reassuring and good thing to know is that the majority of young people do engage a trusted adult, and in most cases that is a parent, but we have to let them make that choice about who that person is and when and how they engage them. And one reason for these trainings is to create sort of that safe, constructive space for conversations so that young people feel like they can open up and talk to us and seek that guidance from all of us, not just, let's say, a parent who they may not be with day to day in this moment.
Great. Thank you, Rebecca. So we have kind of a practice question. So the law says, and the licensing standards say, that young people can keep birth control on their in their personal belongings and in their storage. And you know, so what happens if they share birth control pills, or you know, what would be the advice that you have for STRTP staff in having that kind of conversation with young people? Oh, Rebecca, I think you're muted.
Oh, sorry, I thought you directed that to Luciana. We've definitely heard the concern. First, as a practical matter, it's actually helpful and important to know that birth control pills are quite safe, and so there's not the kind of risk that you might find when, let's say, someone's sharing other kinds of medications. In practice, our understanding is that this really does not happen with birth control pills in the way it might with some other kinds of drugs or medications. I actually want to ask Luciana, who is an attorney for youth and represents youth, what her response would be, sort of if an STRTP specifically identifies a situation where a young person has, let's say, shared birth control pills with another person in the facility.
Yeah, I was going to add, so one of the topics that we actually do cover in our training, and it's one of these topics that are great topic of discussion to see how it actually plays out in, you know, scenarios that you have all experienced within your STRTPs, is the use of reasonable and prudent parent standard. So the California law has the reasonable prudent parent standard, which allows caregivers, it works a little different than STRTPs, to kind of act as a parent. The idea is that we don't restrict youth from doing something that other youth their age would be able to do. But there are situations where a caregiver might have to restrict. So, you know, as an overall rule, I always say the laws are enacted to allow for youth to do certain things, but there's situations where STRTP caregivers do have to step in and intervene. Within an STRTP, I would suggest that a staff person go to their supervisor and decide, or the person who's been designated to be the person who's going to use reasonable prudent parent standard for the facility, and decide whether this is a situation that requires, you know, intervention, and maybe because you're not able to take your pill as directed, this is something that we might have to have, you know, keep and give to you every day. So there are going to be situations where it will require outside of the norm to deal with that particular client. There's some, you know, developmental level, age, all those things have to be looked into.
Yeah, and just as a, you know, someone who would kind of look into the practice of this. So you have one young person who might be sharing, one young person who might be taking. Do they need their own? Do they need to understand their own rights around having their own confidential appointment to receive their own birth control? For the young person sharing, do they know that this would reduce the efficacy for themselves, you know, if they're trying to have effective birth control? So there's some, you know, connect to the nurse at the STRTP, connect to the public health nurse. That's the signs that there are people in that you can kind of have to support in educating young people about those those treatments. They can talk to their doctor, they can get more information, and you can create a safe plan for administration and use.
Yes, and I totally agree with you. I mean, it's also getting to the root of the issue. Why are they sharing? Basically, what's the issue? Does the other youth not have their birth control? Do they understand? So these are all like really great learning moments, and having staff that are trained in this on these topics on how to talk to youth and also where to find information if it requires, educating the youth. Is key. That is absolutely the key of why we need to have these trainings.
Great, thank you. And so there's just a couple logistical questions here. And Simone, if you want to advance to the final slide, just the contact information for all of us, we can continue to answer questions like this as they come up, to direct you to the resources that are available on our websites here. We do have a common question with our webinars, which, do we receive a certificate for attending today's webinar? Now, the answer is yes, but you might need to check your junk mail, because what happens from GoToWebinar is they track folks who registered and attended, and what you'll receive is an email from customer support of GoToWebinar that has a link you have to click, and the certificate will download with your name and today's training information in it. So if you need proof that you attended today's discussion, that's where it will come from. It'll come out in, I believe, 5 hours after today's. It'll be an automatic email, and then for all registrants, we'll send email from us directly with the materials and the recording so that you have those. But if you're looking for that certificate, you might just need to, if it doesn't go directly to your inbox by, if you don't have it by tomorrow, check your spam folder. That's where it'll be, or reach out to us for assistance. Are there any other questions, Simone, or others that we can wrap up with?
I think, since we are at time, we're at 11:30, I think we should probably close. But if there are questions that people have after today or after we close this webinar, like Anna said, we can all be emailed at the addresses on the screen or called.
Great. Well, thank you everyone for joining us today, and thanks so much to our presenters and for the folks who piloted this training so that STRTPs now have a resource specifically for them to help in supporting youth with their sexual and reproductive health. Have a great rest of the day, everyone.